All protocols observed. My name is Hellen Ojwang. I'm a public health officer by profession. I was studying on influence of healthcare staff competency on utilization of universal health coverage in Seme Sub County, Kisumu County, Kenya. My co-authors were Dr. David Otieno, Dr. Daniel Onguru, and Doris Owocha. The study was done in Seme Sub County in Kisumu County, Kenya. And this map is for Kisumu County, where Seme Sub County is situated. And down there on your right is the map for Kenya. And the arrow shows where Kisumu County and Seme Sub County is. The map also has the health facilities. And as you know, the study was also done in the health facilities. Universal health coverage simply means a state where individuals and community members receive the healthcare services they require without suffering financial hardship. The quality of those services should be good enough to improve the health of the people consuming them or receiving them. Globally, 150 million people incur huge health expenditure annually, and household out-of-pocket cost or consume large portion of the income of the community members, and they're forced to forego basic needs including food and other services as they purchase healthcare services. A progress report released recently by the World Health Organization in 2019 anticipated that 5 billion people will be left without full access to healthcare in 2030. They were considering the present rate at which universal health coverage is progressing. In Kenya, universal health coverage was piloted in 4 counties, and that is Kisumu, Machakos, Nyeri, and Isiolo. And the Ministry of Health has taken several strategies aimed at expansion of health service delivery and to ensure affordability of those services. But this has not been successful due to inadequacy of competent staff. As you know, improved competency will make the healthcare provider rightfully understand what universal health coverage require and properly respond to the population need, especially for maternal and child health. The study had a broad objective as to determine the influence of health service provider competency on utilization of universal health coverage in Seme Sub County, with 2 specific objectives, like to assess adequacy of competent healthcare staff in Seme Sub County, and to determine how competency level of healthcare workers influence utilization of universal health coverage in Seme Sub County. Under materials and method, the study targeted health facility managers and the community households which are registered under universal health coverage. The health facilities were stratified according to their levels of care, and the catchment population also stratified according to their administrative location, and proportionate sampling technique applied in each stratum to come up with a desired sample size per strata. And 377 community members plus 8 facility managers were realized for the study. The desired sample size was 385. Data was collected by semi-structured questionnaire. An observation was also done to complement the findings from the health facilities and from the community households. Descriptive statistics were organized in charts and tables, and logistic regression determined the relationship between the variables. And this picture shows data collection from healthcare providers. On socio-demographic characteristics of the community members, in terms of gender, majority of the respondents were female at 57.29%. And with respect to age, majority were 147, that is 38.99%, which were aged between 26 years and 35. On education, majority had completed secondary education as their highest level, and they were 200 at a percentage of 53.19%. On marital status, majority were married at 71%, which we were 270. And with regard to occupation, majority were employed under informal sectors, and they were 71.35%. And the distribution by respondent by monthly income, it was realized that majority were earning between 2,501 Kenyan shilling and 5,000 Kenyan shillings. Despite community members from Seme having been registered under universal health coverage, they still incurred medical expenses for the past 1 year from the time the study was done, that is June 2020. And it was realized that 48% used below 2,000 Kenyan shillings, and 37% used between 2,000 and 5,000 Kenyan shillings, while 15% incurred an expenditure of above 5,000 Kenyan shillings. And this is in agreement with a report from World Health Organization, which revealed that people still experience catastrophic health expenditure, and they use a lot of out-of-pocket in purchase of medical care. Under adequacy of competent healthcare providers, the health facility managers responded that 50% disagreed that there were adequate competent staff in their facilities, while 37% of the managers strongly disagreed that they had adequate technical staffs in their respective health facilities, while only 13 managers were neutral in their responses. On influence of competency level of healthcare providers, it was realized that patients were most likely to use universal health coverage when there were competent healthcare workers, compared, which was at an odds ratio of 2.29 compared to the time when there is no competent healthcare worker. And this is in agreement with a study which revealed that health professionals' competency improved patient outcome, and also that healthcare worker skills, competency, and behavior created trust in the population and promotes demand for quality services. And this table shows the table of the multivariate regression, of which adequacy of health, knowledgeable healthcare worker was at 0.04, and 38 among the respondents had been one day misdiagnosed, and it was at a significance of 0.039, that is the p-value. The conclusions are that competency of healthcare service providers had influence on universal health coverage, as community members were ready to solely use UHC when competent providers are available in the health facilities. The recommendations are that the county government of Kisumu to equip all the health facilities with adequate competent healthcare providers, and the healthcare providers need to get periodic trainings on the new treatment guidelines and even in health promotion to improve their competency. And a comparative study between private and public health facilities should be undertaken to find further evidence on competency of medical staff and its influence on UHC utilization. Thank you.